Firefighters, paramedics, and police officers all face a great deal of unrelenting stress. It can be hard on them mentally, and your support could be crucial. Here to help us assist our heroes is Dr. Samantha Dutton. Samantha is the program director for the University of Phoenix College of Social Sciences. Good morning, doctor. How are you?
Good morning. How are you today?
I am well, thank you. So a recent survey has uncovered some pretty remarkable information about first responders and their mental health. Tell us about that.
Well, we find that mental health first responders are under a significant stress for, irregular work hours, long work hours, exposure to traumatic events, either one or over the many course over their whole career. In our survey, we found that 85% of first responders are experiencing mental health symptoms, and a third of our first responders have an actual diagnosis of PTSD or depression. But we didn't want to leave it there. We want to know, what kind of support do these first responders have? And we found that a half of our first responders have a pre-exposure type training before events, so a prevention sort of service. And then a half of our responders are receiving support after the traumatic event. Great news for that half, but what about the other half?
Doctor, it makes perfect sense. These first responders are around a lot of traumatic incidents. Is there a stigma around folks receiving treatment for mental health issues?
There is actually a stigma, unfortunately. We found that our first responders are feeling pretty comfortable speaking to their supervisor about mental health issues. However, when the process becomes formalized, they feel like there could be repercussions from their supervisor, like getting passed over for a promotion or perceived as weak by their supervisor, or not received well by their teammates. But in reality, those who reach out for mental health services rarely have an impact on their job, but conversely, if they don't reach out, then it can have an impact on their job.
Yeah, it makes perfect sense. I mean, it is like a soldier coming back with PTSD, isn't it? These folks are in traumatic situations. How can we as a community help these people receive treatment and combat these stigmas?
Well, we as a community should work to getting rid of the stigma. And ways to do that is to speak about mental health as a normal part of life. You're experiencing a traumatic event. It's a very abnormal thing to witness, but you're having normal reactions. And so how do we combat that and making that a normal part of life and seeking treatment for such? Encouraging mental health well-being within our communities and within our first responders, and working to prevent such mental health diagnoses as depression and PTSD within this population.
Yes, thank you so much, Doctor. Where can we go to learn more information about this?
You can go to www.phoenix.edu/first responders, and you can find the full survey there.
Dr. Dutton, thank you for shedding light on this issue.
Thank you for having me.
Again, this new survey showed that 85% of our first responders have experienced symptoms related to mental health issues due to high stress and traumatic experiences while on the job. Help them overcome these barriers. For more information, visit the website on your screen. The University of Phoenix is a proud sponsor of the Morning Blend.